Hello. We talk a lot about our heart health and physical health, but what about our brain health? A local researcher is here to help us understand what we need to know about brain health and Alzheimer's disease. And it's a major milestone for a local organization supporting trans people in Pittsburgh. We'll hear about the groundbreaking expansion that's offering more services in our trans community. Plus, a short film about a local doctor had a major screening at a national film festival. We're talking to her, the director, and the leading actress of In Good Hands. So pull up a chair and meet us at the corner. Intersection starts right now. Hello, I'm Lisa Smith, the Director of Community Impact at KDKA Plus and the host of Intersections. Well, June is Alzheimer's and Brain Awareness Month, and chances are you know someone with the disease. The numbers are staggering. In Pennsylvania, it's estimated that almost 300,000 people 65 or over are living with Alzheimer's, and Black Americans, they are 2 times more likely to have Alzheimer's than white Americans. Last week, there was an African American Summit on Dementia presented by the Alzheimer's Association of Greater Pennsylvania. So my guests today were part of that event. They are Dr. Lilcelia Williams. She is the research faculty member at the University of Pittsburgh School of Medicine. Also, Janae Sink is the Western Pennsylvania Program Outreach Manager for the Alzheimer's Association of Greater Pennsylvania. Thank you both so much for being with us. We appreciate it.
Thank you.
Hello.
Thank you for having us.
Yeah. So tell us a little bit about the event that was held last week. Dr. Williams, you were, I guess, the keynote speaker. What was your message to those who were assembled for that event?
My takeaway message for that event was that Black brains matter. At the intersection of social characteristics that would be like our age, our gender, our socioeconomic status, as well as those non-medical factors that influence how we live, learn, work, and play, those are the things that impact our risk and increase those risks, and those are also things that can modify our risk and lessen our risk as individuals who identify as Black or African American.
Yeah. So when you talk about brain health, what does that mean? I mean, like I was saying, we hear about heart health, and we know that we have to keep our bodies healthy. But when you talk about brain health, what does that mean? How do you decipher that?
So I'd like to take a step back from that just a moment. I like to think of it as an ecosystem. We have our general health, then we have our brain health, and we have our heart health. Yes, they are independent systems that functions within our body, but they all have a specific function, and you can't have good brain health without good heart health, because our heart is actually feeding oxygen to our brain, so they are in alignment. So in our conversation at the summit, we talked about that. The things that are good for good brain health also promotes good heart health. So brain health in a sense, is being able to function and thrive in your context, whatever your context is, but not just live, but survive and thrive in that context.
So does that mean, exercising and eating healthy, the same things that support heart health, supports brain health?
Yes, engaging in brain activity daily, whether it's conversing in a debatable but friendly conversation with someone, learning a new language, going out for coffee with a friend, exercising, limiting our smoking and our drinking, good sleep hygiene, all of those things work towards good brain health.
Yeah. So Janie, with the Alzheimer's Association, obviously you guys do a lot of work in this space. What do you tell people around what they should look for when it comes to Alzheimer's? Are there telltale signs?
Sure, yeah. We have an amazing team of trained volunteers who go out, and Dr. Williams has a colleague also, Melita Terry, who does the same thing, where we talk about the 10 most common warning signs. And now I was just talking to someone over at the stadium this morning about this subject. What that looks like for each person can vary widely. So we talk about short-term memory loss, about confusion, peripheral challenges, and many more. But how that plays out with each person is unique. So, someone who could be diagnosed, like when my dad was diagnosed 11 years ago, he was having short-term memory loss and repetition of stories. he would forget that he was repeating the same thing from the previous day. But on the other hand, my grandmother, who we suspect had dementia, but never got a formal diagnosis, she had several things. So yeah, it varies widely. Each kind of journey through the experience is very different.
Yeah, a lot of times, you hear about, early detection and,
Right.
Things like breast cancer, right? It's like, oh, okay, so you can start having mammograms at age 40 or 45. What does early detection look like when it comes to Alzheimer's?
Sure. Well, we're talking about the warning signs that we just mentioned. There's still a big stigma around it. So, to your audience and to our audience at the summit, it is so critical to have a very real conversation so that people are at ease talking about it. Still to this day, in certain communities, I'm South Korean, we're a little feisty at times. We don't always like to share our health challenges. And I have a volunteer, and this goes to the point of having the summit, where she grew up in Pittsburgh, they never could talk about it. So that early diagnosis is, confronting this, having a real, let's normalize the conversation around it and get people to their primary care provider so that if there is, in fact, a formal diagnosis, they can talk to a specialist and get all the support that they need.
Yeah.
Make an informed decision.
Yeah. And then Dr. Williams, you do research in this area. Tell us a little bit about, the research that you're doing and why it's significant, especially in the African American community, and when you're looking at disparities.
That is a very great question, and as you noted in the intro to the segment, that those who identify as Black and African American have an increased incidence of developing Alzheimer's disease or related dementia, 2 times that greater than their non-Hispanic white counterparts. And to boot, or to go with that, they are also diagnosed almost 3 years later and with greater severity. So it's very important to be on top of that preventative measures to detect it early. But with that being said, we don't have a group across the contiguous U.S. that will support cognitive screening for people under the age of 65. So that's important to have that regular conversation with your physician, to build a reputable relationship with your primary care provider, to be able to go to say, hey, Cece, what's a little bit different? Are you feeling different? Are things off with you? To bring your authentic self to that appointment, and that's part of that. So I am very, very, very blessed to be able to engage in research in our communities where I partner with the community members to see what the gaps in knowledge are as it relates to brain health, dementia, and everything that goes along with that. So I want to be clear to denote that in our conversations that we're having in the community, we're having conversations about brain health, but I'm also bringing into that conversation heart health, because they are so important together. So I am so blessed to be working on a project that we have right now at the University of Pittsburgh, where Dr. Jennifer Langler is the principal investigator of that, where we're going out into the community and actually gauging the pulse of knowledge about brain health in the community. And that particular study is called Brain Check Allegheny County, where we're also, partnering with Allegheny Department of Health, as well as the Black Equity Coalition. So we've done a multitude of exploratory conversations, one-on-one interviews, where we're learning what is actually the knowledge gaps as it relates to brain health. Is it even a conversation we're having in our communities? And if we are having those conversations, is it a candid conversation? Going back to Janie's point, we have this habit in the communities in which we live, that what happens in my house stays in my house, and I don't share that information. If I'm not willing to share, then I can't get the resources that are available to me, and I can't get that help early.
Yeah. Well, clearly this is a topic that we should spend more time on. We're out of time for today, but we'll definitely look for an opportunity to bring you guys back to talk more about this, because it's definitely important. Thank you both so much for being with us.
Thank you
for
so
having
much.
us.
All right. Well, coming up, the leader of an organization that supports Pittsburgh's trans community marks a milestone. Intersections, we'll be right back. Well, as we continue to celebrate Pride Month, one local organization is marking a major accomplishment. For 15 years, Sisters PGH has been behind major efforts to support the Black and brown trans community, and this year that support is expanding. Here to tell us more about the growth is Ciara Thomas. She is the founder and executive director of Sisters PGH. Thank you so much for being with us. We appreciate it.
Of course, thank you for having me.
Yeah, so we were talking before, and you were kind of explaining just how this all
Yeah.
came about.
Yeah.
You were a teenager,
Yeah.
and you found yourself on the streets.
Yeah. Yeah.
And there was a need.
Mm-hmm.
You had needs, other people had needs.
Yeah.
Tell us how you started meeting the needs of the trans young people who were on the streets here in Pittsburgh.
Yeah, by simply providing the first piece of housing that I was able to have, as a homeless teen, and being able to have my first little efficiency in Garfield, and moving them all in my house, when it was still a small space, but being able to really actualize and think about what housing can really look like for us. So that really pressed me forward with my journey with Sisters PGH on how can we not only deconstruct the nonprofit industrial complex as a nonprofit, but also provide tangible resources to really curb the housing crisis here in Pittsburgh for trans people of color.
Yeah. So I know that this 15-year mark has been a lot, but you guys have a lot happening to really market.
Yeah.
So I guess you've already had your events, but tell us why now was the right time to have a celebration, have a gala.
Yeah, it's been 15 years. We're the longest running Black trans women-led organization in the city and the county in the state of Pennsylvania. And to get to this mark is monumental and inspiring to other organizations, trans-led organizations that are into this work, being inspired by the leadership of Sisters PGH. So it's truly, even as the founder, I'm just thrown away at times, and thrown away in a good way, but at times that we're here because it took a whole lot for us to make it to where we are. They say us as Black folks, you got to work twice as hard, 3 times as hard, and it felt like we had to work 5 times as hard to even achieve the accomplishments that we do have now. So it's been a full circle and humbling moment, and I'm, again, as the founder, am more excited that the community gets to experience this and experience the resource that we do have to offer, because that's what it's about, making sure that they get the services that we need as a trans community of color.
Yeah, talk about some of those services, because it's casework, it's more than housing.
Yeah, absolutely.
Talk about a little bit of the things that you guys do.
Yeah, so we just rolled out a behavioral health program that provides therapy for trans folks and tailored for trans folks. This is something that has been a need for a long time. We all need some form of therapy, or behavioral health in our lives. But to be able to provide that in our organization as a trans-led organization is a huge, huge feat for us to have an LPC that can actually actualize service provision in behavioral health for our clients, and for me to be able to oversee that and make sure that everything is going correctly and that our community is being served with dignity and respect and love and honor and all those things that comes along with needing services. Because I know when folks come into our doors to receive our services, our housing services, our case management, our drop-in spaces, they're depleted from going to different spaces and not getting everything that they needed, not seeing themselves in the leadership, not seeing themselves in the leadership, helping to make the decisions on what's happening within the organization. And we're able to really catch them where they are and affirm that I'm sitting here in this leadership role, so that means you can be sitting here in this leadership role. So being able to be not only an inspiration, but a resource through our case management, through our behavioral health programs, through Monica Roberts' Place, our 1-bedroom apartments. Project T is our transitional housing space for Black trans women and girls experiencing housing insecurity. So to be able to provide these things has been a monumental feat. And I'm humble every day I wake up to continue to do this work and provide this vital resource for our community.
Yeah, we only have like about a minute and a half left, but I want to talk about the expansion that's happening.
Yes.
Stonewall in Pittsburgh.
Yes.
Tell us about that.
Yeah, so Stonewall in Pittsburgh, of course inspired by the Stonewall Inn in New York City, when my ancestors and ancestors were fighting for the liberation of trans people, especially Black and brown trans people. We're bringing that to Pittsburgh in the 21st century to really actualize service provision for the trans community in trauma-informed care for the trans community within our space. We're housed in Emerald City, which is a historical building, but even more historical because a Black woman owns the building now. Shout out to Camille Bailey for her amazing work. But to be able to have a separate but space in Emerald City. It's a dream come true. When I started Sisters PGH, I've always envisioned it to be stationed right in downtown Pittsburgh. It was not feasible back then when I started it because we didn't have the resources to do so, but we're in a different space now and we're able to house Sisters PGH right in downtown Pittsburgh. So it's been, it's been great.
Well, we're out of time and we didn't get to talk about that other expansion, but we're going to save that for later.
Okay, sounds good to me.
But thank you so much for coming, and congratulations on all your success.
Thank you again.
All right. Well, coming up, the world of a local doctor is showcased in a major film festival. Intersections will be right back. Well, it's not every day that your movie gets selected to be showcased in a nationwide film festival, but that's exactly what happened recently in Miami. The film is called In Good Hands, and a group of Pittsburghers saw their film compete for the HBO Short Film Award. It is one of only 5 films selected, and joining us to share more about the film, the trip, and everything else are Dr. Sylvia Owusu-Ansah. She is a pediatric emergency medicine physician and the inspiration for the movie. Chanel C.J. Harris, the leading actress in the film, and film director Nick Buheit is also joining us. Thank you all so much for being with us.
Thanks for having us.
Yes. Okay, so what was it like being in Miami, seeing the movie on the big screen? I'm not sure how large the screen was, but what was the whole experience like?
Surreal. It was definitely surreal, and a little bit nerve-wracking because the very first film that came on had a major actress in it, and I'm like, oh, okay, I didn't realize we were going this big with it, but it was definitely a labor of love that you got to see come to light, and you could just like, oh wow, this is really happening, and to see it up against some people who have big films, it stood the test of time. It really stood up against the other work. So pride, grateful. Yeah, that's how I felt.
Yeah, Dr. Sylvia, you were the inspiration for this. It's based on a book you're working on. So tell people a little bit about what In Good Hands is about.
Yeah, so In Good Hands is about my work life as a Black physician in a pretty homogeneous environment, meaning predominantly white environment, and the microaggressions and overt racism that I face on a daily basis while trying to save children's lives. And it's amazing how this team was able to bring that story to life in the way of Chanel's acting. I joke that she acted better than myself, in the way of Nick's directing, and Yasmin Crawley, who's not here, screenwriter. But it's really about, Black providers trying to overcome every single day to save lives. Only 5% of active physicians are self-identified as Black. Our Black males are not going into medical school. We've been stagnant at 2% when it comes to Black male physicians in particular. So there's a lot of work that needs to be done in that space, and people need to know.
Yeah. So Nick, you're the director. What was it like for you to kind of get this portrayal together in a weekend, as I understand it? I understand this all took place, shot in one weekend. How did you do that?
A great team. We did have some prep time as far as a few months ahead of time to kind of collaborate together and figure out how we're going to execute this. But 16 pages in 2 days is no joke. Ideally, we never have to do it again, but that's not how it always works. Yeah. It was a great team, and I think really everyone bought into doing the story justice and making sure we're all on the same page, ready to go, so that way we can knock out as much as we can. And Haji and I, the cinematographer, we did some things where it's like, we're going to do this scene in one shot and do a couple takes of it, and that's the only way we're going to film it because we have no other choice. One, that's the energy we wanted for those moments, but two, we really have no time for coverage, which is sometimes the best creativity comes from, obstacles that you have to overcome.
Right. Pittsburgh is seeing a lot of films shown. Is this your first directing, or have you directed other films?
Commercially, I've directed things, but as far as a creative project, it's actually the first short film I've done since college, which we will not talk about how long ago college was. Yeah.
All right, so Chanel, tell us a little bit about portraying a doctor and the inspiration you got from Dr. Sylvia to pull this off.
So her and I trade back, like giving each other flowers all the time because she's such an inspiration. I've learned so much from her. First of all, I suture now. I just want to go ahead and say that I know how to suture. I know how to properly, if anybody's bleeding out, just see me.
You don't
I got
just
it.
play a doctor on
Yeah,
TV.
I got it. I can definitely do it. But just the inspiration of Freedom House and learning about EMS and 911 and how it started in Pittsburgh. I've been in Pittsburgh education all my life. I never knew that. I've went to suburb schools to Pittsburgh Public. These are things that I just did not know that we even possess in our own city. And I just have learned so much from her and just what she's doing and how she champions to do CPR. So the inspiration was like, I already have my own racist interactions I've dealt with the healthcare system with my husband and his kidney. But just, it was like a story that I had to jump in. I was like, oh, I got something to say. Oh, I understand what they mean.
Yeah.
So I was excited, and then to learn all that she's got going on, and it's just layers. She's like a beautiful onion.
Yeah. So speaking of layers, what is the next step for this film? We have about 30 seconds.
Yes, so we're working on that now. We're hoping to do some local screenings to the public and enter into some more film festivals now that we have an official premiere. And so grateful to the American Black Film Festival for being the first film festival to premiere our movie.
Yeah. Well, bravo to you all. Thank you all so much for being with us and sharing. And we will look forward to seeing this the next time it's on the screen.
All right.
Thank you for having us.
Thanks
for having us, for sure.
Thank you. And I'll have my last word when we come back.
Pauline Park is a transgender activist whose work dates back to the 1990s. She's the co-founder of Queen's Pride House and the New York Association for Gender Rights Advocacy. Park also has been instrumental in the passage of several transgender rights laws. 20 years ago, she became the first openly transgender person to be the Grand Marshal of the New York City Pride March, the oldest and largest pride event in the U.S.
Juneteenth. More than 2 years after slavery ended in the U.S., it actually hadn't ended in Texas. Without the enforcement of the law, the enslavement continued until June 19, 1865, when Union soldiers, by order of Major General Gordon Granger, declared to the people of Texas that in accordance with the Emancipation Proclamation, all slaves are free. It was cause for celebration, a jubilee, which freedmen started having annually on June 19th. However, slavery still existed in a couple of states and areas of the country until the abolition of slavery by passage of the 13th Amendment. Thanks for watching. We'll see you next time on Intersections.